And let's dive in now into our topic. Again, we're talking about Medicare eligibility for immigrants through QMB. But let's talk about what the heck Medicare is and the different parts. There's lots of letters involved with Medicare. All right, this is just a general overview. Today's main topic is about immigrant eligibility, but I just wanted to kind of talk to you about what the heck Medicare is and what you're fighting for and what coverage you get. So Part A, think of it as hospital. So think of it as hospital stuff, kind of emergency, really, forefront services that you need immediately. That's going to be the Part A stuff. That includes inpatient hospital stays. That also includes what we call skilled nursing facility care. And Part A also does cover hospice and then some home health. Okay, that's Part A. Think of hospital, A hospital. A is the first thing you need, and sometimes the first thing you need is hospital care. B, think of it as just your regular everyday monthly visits to your primary care or your specialty care doctor. So these are just kind of the everyday outpatient stuff. So outpatient stuff, it also includes DME, durable medical equipment, and some preventative services. So this is kind of, think of B as the everyday going to see your doctor stuff. And skip C for a second. Part D is easy to remember because D for drugs. Drug coverage is for your prescription drugs. For Part D, you have to actually be, well, not have to, but we'll talk about the different options. But Part D typically is going to be provided by a plan. They're private insurance companies who are contracted with Medicare to provide those services. And then there's C. C, we also call Medicare Advantage plans or MAPs. Think of it all as like an all-in-one alternative. So this is optional. Can you guys see this, the optional, when I write it in? Can I get a verbal yes?
Yes.
Okay, thanks, Gabby. All right. So basically with Part C, it combines your A plus, think of like basic algebra back in high school, okay? Part B, but Part A, Part B plus D equals C. It's everything that original Medicare includes, except oftentimes these Medicare plans will like throw in some bonus benefits. So things like some dental coverage, some vision, some over-the-counter. Sometimes they'll include like a gym membership, just to entice you to say, hey, join our plan, join our plan. These are things that original Medicare would not cover. So original Medicare, all the letters is the A and the B, and then you're going to need a plus D plan. Part C plans are Medicare Advantage plans. If you watch daytime television at all, you're bombarded with a lot of Medicare Advantage plans advertising, hey, join our plan, you could get this, you can get that. So that's what those commercials are all about, Part C plans. So let's kind of break it down. Oh, okay. Okay, we're going to talk about Part A. We're going to talk about Part A and then the different types of kind of enrollment options, okay? So there's something called free Part A and then premium Part A, okay? There's free Part A, I'm going to put it in quotes, and then premium Part A. So we're going to break down each of those different types of Medicare Part A. So Medicare Part A can be free, right? Let's talk about free. When it's free is when you or your spouse have paid into the Medicare system. So I don't know if you've ever had like a pay stub job where you see how much taxes are being taken out of your well-earned money, and there'll be a line that says Medicare, Social Security. That means that the money that you're earning from work is going into the Social Security pot. If you have approximately what they call 40 quarters, which is about 10 years of work, then you will be eligible for Medicare when you're eligible. It can be under your own work history, or it could potentially be under your spouse's work history, okay? So for those who paid into the Medicare system and you have enough work credits, you got the 40 credits, you've worked at least 10 years, and paid into the Medicare pot, you will be eligible for free Medicare Part A. However, immigration status does matter. You have to be either a US citizen or lawfully present. And we're going to talk about exactly what lawfully present means in a minute. Okay, so again, you don't have to memorize all this. This presentation is going to be recorded and the slides are going to be available to you. Just if one or two of these things sound familiar to you, by the end of this presentation, I've done my job. Okay, let's talk about Premium Part A. Okay, so Premium Part A obviously is not free. It costs money. It's going to cost money. Currently, the premium for Medicare Part A is, it can be over $500 per month. It is very pricey, and we're going to talk about ways to be able to not have to pay and avoid the $500 per month. But these are for folks who either have no Medicare work credits or not enough. Again, it could be like, you know, less than 10 years of earnings and work credits. And so you're going to have to pay for your Part A. For those who have to pay for their Part A, the only immigration status that you can have to be eligible for paying Premium Part A is you have to either be a US citizen or a green card holder who has had 5 years of continuous residence. No other immigration status is available for Premium Part A. And we're going to go into a deeper dive in each of these categories. Okay. All right. Free Part A. All right. So we're talking about folks who have had at least the 10 years of paying into the Medicare pot. Okay. Again, this is the same slide, about 10 years of work credits. And then again, the citizenship category or the lawfully present category. Well, what the heck does lawfully present mean? Let's dive into it and kind of piece out each of the immigration categories that are allowed. Okay, there has been changes with HR 1 passing with, they call it the One Big Beautiful Bill, HR 1 that was passed on July 4th this summer. Medicare will now be limited to only the following categories of immigrant populations. So it's only going to be for US citizens. It's only going to be for green card holders. It's only going to be for Cuban and Haitian entrants. And then it's only going to be for folks who are what we call COFA citizens. So COFA includes the Marshall Islands, Micronesia, and Palau. These are the only categories going forward. This is effective as of now because this was passed back in July in the summer. This is currently in effect, and this is what the rule is and the law is of the land at this time. Starting January 1 of 2027, Social Security unfortunately will terminate Medicare eligibility for these folks. These folks used to have access to Medicare before HR 1 passing, before Congress and the president had signed off on HR 1. These folks here used to have Medicare eligibility. They used to be okay to receive Medicare. The law has now changed with Congress and the president signing HR 1 into law. And so all of these folks who currently have Medicare, who are in these categories, in about a year and a half's time, they're going to be cut off. Folks, refugees, people who are granted asylum, those victims of human trafficking, domestic violence, immigrants are folks who are granted humanitarian parole. Even if you paid into the system and paid into the Medicare and Social Security pot, or not Social Security pot, I should just say Medicare, just for the Medicare pot, if you are in one of these immigrant categories, you will not be eligible for Medicare. If you are currently on Medicare and you're one of these categories, your Medicare will be terminated in 2027. So this is a big, huge deal. It's affecting a lot of us and a lot of our community members. And so if there's anyone, if for yourself or there's a, a family member you're not sure if this applies to, feel free to have, your family member give us a call and we could kind of set them straight to make sure maybe it doesn't apply to them, maybe it does. Okay. But I just want to let y'all know that this is happening now. This is as of July 4th. Okay. I didn't want to scare y'all, but I need to make sure everyone is aware of these new legal changes that are happening. A lot of stuff's changing, like bam, bam, bam. And some of it's gonna be delayed, and some of it's just in effect now. So just, if you guys are ever confused about timelines, give us a call and we could sort you out. Okay, let's talk about DACA, folks. DACA stands for Deferred Action of Childhood Arrivals. Unfortunately, Medicare has never been, on the table for DACA folks. Folks were never, even before HR 1 and with HR 1 passing, unfortunately, DACA folks were never considered lawfully present, so they're not eligible for Medicare. They're also not eligible for Covered California. This is really bummer news. For a very short period of time, we had DACA folks eligible for Covered California with premium subsidies for like a 6 to 7 month period. But starting July 1, the federal government has said, hey, DACA folks are not going to be eligible for Covered California with premium discounts, premium subsidies. So unfortunately, Covered California is not on the table for DACA folks. However, the good news, hopefully this good news will stay, but the good news currently is that Medi-Cal is still, DACA folks are still eligible for full scope Medi-Cal, not just emergency only Medi-Cal. If you are currently a DACA Medi-Cal recipient, you will retain your full scope Medi-Cal benefits. Unfortunately, because of state budget cuts, the DACA folks will be losing their dental coverage through Medi-Cal, and they're going to have to start paying a $30 a month premium starting 2027. So these are kind of the effective dates of these new changes. A lot of moving parts, a lot of changes. If you're confused about it, if you have a family member or yourself are classified as DACA, give us a call and hopefully we'll be able to kind of set you straight. Okay, this is completely undocumented. So if you don't have any immigration status, unfortunately, undocumented individuals are not eligible for Medicare. Undocumented individuals are not eligible for Covered California with premium subsidies or discounts. Medi-Cal, it gets a little complicated, but let's break it down. So yes, if you are undocumented and you are under the age of 19, you are eligible and still remain eligible for what we call full scope Medi-Cal. So not just emergency hospital-based Medi-Cal, but full-blown Medi-Cal, okay? So if you're under 19, you're good to go still. If you are older than 19, starting January 1 of this year, undocumented individuals who are over the age of 19 will no longer have access to full scope Medi-Cal. Okay, but let's kind of break it down because there's kind of two different categories of people this might affect. So for this population, you wouldn't have full scope. You're going to have emergency only. So emergency only, what we call restricted Medi-Cal, does include hospital care, does include skilled nursing facility care, and it does include like emergency dental. So like if you're having like a need for like an emergency root canal or something like that, those would be covered. But like regular day-to-day medical and dental services would not be covered by Medi-Cal. Okay, so let's keep in mind, this is an enrollment freeze for undocumented 19 years plus starting January 2026, okay? So what that means is if you are undocumented and you apply for Medi-Cal after January 1 of 2026, you're only gonna get the emergency Medi-Cal, okay? So you're not gonna get the full scope Medi-Cal. So you're not going to have Medi-Cal with CalOptima. You're not going to have Medi-Cal with Kaiser. It's what we call fee-for-service, FFS. And it's only emergency. Okay, but what about currently? If you already have Medi-Cal and you are currently undocumented, currently you have full scope. You're going to have full scope, and then even after January 1 of next year, you will still keep your full scope Medi-Cal. The only difference is you're going to lose out on your dental starting July of next year. Because again, because of budget cuts, they're removing the dental benefit for undocumented individuals starting July of next year. Okay. I know this was a lot. I'm going to take a little pause for now. We're going to do more of a deep dive into Medicare, but I just want to see if anyone had questions at this time, or if you want me to go back to any of the slides, I'm happy to do that. I've said this before and I'll say it again. I do not mind awkward silences. If it means you're still thinking through your questions or hesitating and asking, don't hesitate. This is a safe space. There's no such thing as a dumb question. The question that you have is probably the same question that all of us do have in our heads. So say it out loud. Okay, well, we will have time for questions at the end as well, but feel free to just interrupt me because I like to make sure we ask questions along the way, you know, while we still have the slide up. Okay, moving on. Let's talk about premium Part A. So this is premium Part A, so not free. This is the type of Medicare Part A that you have to pay for. This applies for folks who have little to no work credits for Medicare. So let's talk about it. Medicare, again, this is the same slide as before. Premium Part A, again, the Medicare premium can be up to $500 or can be over $500 per month. And again, it's for folks who don't have any or not enough work credits. So that, again, that's less than the 10 years. So for premium Part A, the only two categories that are eligible are those who are US citizens and those who are green card holders and who have been in the US for 5 continuous years. Okay, so let's break down what this means. Okay, so just to, I put this in here to remind folks, no other immigration status categories are allowed for premium Part A. So it's either 1 or 2, 1 or 2, and that's it. Okay, so what the heck does 5 continuous years mean? Let's break it down. Can I leave the US for a quote temporary visit? That's okay. Temporary is considered less than 6 months. So when you get your green card, one of the kind of prerequisites is you're saying to the US government you're not planning on leaving the country for more than 6 months. But if you, you know, just so that Social Security kind of breaks down some types of factors that they would consider as evidence in saying, hey, no, I'm planning on remaining a US citizen. Things like maintaining a house or apartment, you know, making sure you still have furniture at that place, paying US income tax for still during the time that you were out of the country, you know, returning to your same job in the US, you know, departing with a reentry permit. You know, these are just some legal factors that you can show as evidence to say, no, I am planning and I still remain as a US resident. Oops. Okay. All right, issue. Not eligible for free Part A. Again, for free Part A, you have to have, it's based on work credits. You need about 40 work credits, 40 quarter work credits, which is about 10 years of earnings and paying into the Medicare pot. Some folks don't have enough of these work credits, so they have to buy the premium Part A. Again, the problem is it costs a lot of money. Let's break it down how much it costs. In 2025, and this number goes up every year, it's if you have less than 29 quarters of Medicare work credits, you're paying $518 per month for your Medicare Part A. And then if you've had about, you have some work history, but just not enough to get to the 40, you're paying less, but it's still pretty pricey at $285 per month. So that's the problem, right? This is a lot of money for folks. And this per month is food. It's a huge part of your rent or your mortgage. This is a lot of money. So what can we do about it? QMB, this wonderful, amazing program that no one knows about, can pay for your Part A premiums. So they can be paying for these really high premium amounts. So let's break it down as to what the heck this QMB program is. QMB stands for Qualified Medicare Beneficiary. Again, you're not expected to memorize all this stuff, but if some of these letters sound familiar to you at the end of this presentation, you get an A+. Okay, so there is an income limit, and there will be an asset limit starting January 1. For just as an FYI, Medi-Cal is reintroducing their asset limit starting January 1, and that also applies to the QMB program and the other Medicare savings programs. So for QMB, you have to have an income that is below these amounts. Okay, so if this is for an individual and this is for an individual with a spouse, it's a pretty low threshold, but unfortunately, a lot of our clients and a lot of folks out there are under these amounts. And so you will be eligible for Medicare if you are under these income caps. So for an individual, less than or $1,305 or less per month. And then for a married couple, $1,763 or less per month. But if you are eligible and your income is below these amounts, there's lots of wonderful, amazing things that come with this QMB program. So let's talk about it. All right, the QMB benefits includes QMB pays for your Medicare Part A premiums, pays for your Medicare Part B premiums, and takes care of your deductibles and coinsurance for Medicare. So for Part A premiums, this amount that they pay for your Part A deductibles, these amounts. For your Part B premiums, it's currently $185 per month. And then your deductibles for Part B is this much. 20% coinsurance is a lot of money. If you get stuck with, say, for example, you got hospitalized and your hospital bill was $100K because you were there for several weeks, paying 20% of that would be $20K. $20K is a lot of money, but theoretically, if you had QMB, you wouldn't have to pay the 20 grand. So you wouldn't have to pay for this amount, you wouldn't have to pay for this amount, you wouldn't have to pay for this amount, and you wouldn't have to pay for these amounts. This is the beauty and the wonderful benefit of QMB, okay? Another benefit, if that wasn't convincing enough, QMB also protects you from what we call Medicare cost-sharing bills. So providers cannot bill you for Medicare deductibles or that 20% coinsurance. So that includes doctors, that includes hospitals, that includes your DME providers, any other medical provider. Once they know that you have QMB, they should stop billing you. QMB folks should not be billed. Okay. How do you get the Medicare and the QMB? There are application steps, and it depends on which category of folks you fall into, but let's break it down. Okay, this is a little confusing, and I don't expect you to memorize this. This is more as like a cheat sheet for you to reference in the future if you ever need to. But this cheat sheet really kind of answers most of the questions on how you would apply for Medicare and QMB. So hopefully you would fall within one of these groups, and then you'll find out what you need to do to get eligible for Medicare and QMB. Okay, so this is for SSI folks. So if you have SSI, that's Supplemental Security Income, you're getting monthly SSI benefits, and you have already SSI linked Medi-Cal, And you're eligible for free Part A, meaning, you paid into the system, and but you're also receiving SSI. For these group of folks, you don't need to do anything. You're going to be auto-enrolled into Medicare and auto-enrolled into QMB. So you don't have to do a darn thing, and you'll automatically get the Medicare and QMB benefits. So for folks who have SSI, but those who may have to pay a premium for their Part A, so for those who didn't have enough work credits, those folks also don't need to do anything. They're going to be auto-enrolled into Medicare and auto-enrolled into QMB. So don't need to do a darn thing. These have been changes that have recently happened in the last year and a half. And so we're very grateful for these legal changes, because these folks used to have to actually apply for these programs, but not anymore. You don't have to lift a finger, and it just automatically happens in the back end with the computer systems talking to each other. Okay, let's talk about this. Individuals who don't have SSI, but who are already enrolled into Part A with a premium and already have Part B. These folks, all you got to do, you got to go to Orange County Social Services and apply for QMB. Just you go into the office and say, hey, I want to apply for QMB. If no one knows what the heck that is, talk to a supervisor until you speak with someone who knows what QMB is, and they'll give you a QMB application, and you can go ahead and file. So you only have to do step one. You just have to go to Orange County Social Services, AKA the county, AKA the Medi-Cal office, and apply for QMB. All right, so let's go talk about these folks. These are folks who don't have SSI, who are enrolled in Part A, enrolled in Part B, but are eligible for Part A, but don't have it just yet. And it's with Part A with a premium. So those folks, same thing. All you got to do is go to the Orange County Social Services office, ask for a QMB application, and apply, and then you're good to go. And then lastly, this is the kind of the last group of folks. These are folks who don't have SSI and who currently do not have Part A or Part B at this time. These folks will have to do a two-step process, but the step one is to go to Social Security. So Social Security are the feds. Orange County Social Services is the county. So they're two different agencies. You go to Social Security first, apply for Medicare Part B and conditional Part A, and then second, you go to Orange County Social Services. You have to do it in that order. Yes. Okay. So for these folks who don't have SSI, who are not enrolled in either Part A or Part B, you still have to do the two-step process of applying with Social Security, the feds, and then applying for QMB with the county, with Orange County. Okay. This is a lot. I know I threw a lot of info at y'all, but think of this as a cheat sheet that you can refer to in the future. If you ever are like, where do I go? What do I do? How do I do this? You can refer to this page and then look at each of these groups to see which one applies to you. If you need assistance, obviously you could give our office a call and we could help you figure out which one of these groups you fall in. Okay, any questions at this time? I know this is a lot, guys. Again, think of it as I'm presenting it to you. If some of it gets absorbed in your brains, great. But you're not expected to memorize all this stuff. But you have the slides and the recording to refer to in the future, and you could always give us a call for assistance. No questions? Questions? Okay, I'm gonna move on. All right, so this is for the last group, right? These are for folks who do not have SSI, who are not enrolled in either A or B. Okay. So step one, you apply apply for Medicare with Social Security. Again, this is the feds, okay? Do not confuse social services with Social Security. I know there's a lot of S's and social in both of those titles, but this is the federal government, okay? The federal agency. You used to have to wait January through March and that tiny little 3-month window to apply. No mas. You can do this year round, any time of the year. You can apply for your Part B, Medicare Part B, and Premium Part A. When you apply, it depends on when you first become eligible for Part A. So that could be when you turn 65 and you've been residing in the US for 5 years, or, perhaps you came to the US a little bit later in life, if you're over the age of 65, but you've been in the US for at least a 5-year period. That's when you're gonna wanna go to the Social Security office. I'm gonna skip this part, it gets a little confusing, but this is more for like Medi-Cal, Medicare, and QMB nerds like myself. Okay.
And Joan?
Yeah.
We have a question in the chat.
Oh, yeah.
Can you complete the QMB online?
So we've been asking the state, the Medi-Cal state agency, to make it available online. I don't think it's available online. I still do think you could probably apply for QMB over the phone. And if you already have Medi-Cal, you should have been screened for QMB. If you have Medi-Cal and you don't have the QMB, then you can always just call the 1-800 number with Orange County Social Services, or if you have an assigned caseworker, you could call them and say, hey, I want to apply for QMB. So I don't think at this time QMB is available online, but I believe you can also fill out the form. There is a form that you can fill out and you can mail it to. So I just don't know if online is accessible at this time. We've been as advocates and attorneys, we've been asking for the state, hey, make this available online, make this available online. I don't think they've done that just yet. Yes, but we'll talk about in the next slide how to get the form and how to apply otherwise. Okay. But step one, again, this is step one. Step one is you have to go to Social Security first, the place with the eagle on it. This is with the feds. You're going to have to go apply for the Medicare. What you want to do is use the words conditional Part A. Say, hey, wave your flag and say, hey, I want to apply for conditional Part A. If you have a Social Security rep who doesn't know what the heck that is, do not leave until you speak with a supervisor who's familiar with conditional Part A. I've had so many of my clients say, hey, I went in and they said they don't know what that program is, and so I left. And then I had to tell them to go back, and they had to wait another, 30 minutes to get a number, or an hour, or several hours. So make sure you do not leave the Social Security office until you have a conditional Part A application in place. Where do you go? You go to Social Security. Social Security now kind of has limits in as to in-person assistance. So if you can apply for it online, I'm trying to figure out, I don't know if they now have conditional Part A applications available online. But at a bare minimum, you want to go online to at least schedule an appointment. Social Security now schedules online appointments online that you can come in. And so make sure to go to the Social Security website first. Okay, but this is for step 2 now. Step 2, once you've done and you visited the Social Security and the feds, you're going to go now to the county. You're going to go to Orange County Social Services, with the little orange icon. You're going to go to the Orange County Social Services office, and you can apply in person. Like I said, I don't think it's available online just yet. There is a paper application that you can mail, And you can also apply via telephone. If you already have Medi-Cal and want to apply for QMB, you can just call and request for a QMB application. But when you do apply, you're going to want to make sure you provide a copy. So Social Security will give you like a printout saying, hey, you've applied for conditional Part A. And they'll print out this letter. Bring that letter to the county or mail that letter to the county. Or social services might give you this form. It's called the QMB request enrollment form. So Social Security might also give you this form. So whichever you receive from Social Security, make sure you present it to Orange County Social Services. So remember, step one, you're going to the feds. This is Social Security, the eagle. And step two, you're going to go to the orange, the fruit. So the two different agencies. This is the county agency, Social Security is the feds. Okay, the question is, if I already have Medi-Cal, why the heck do I need Medicare? And that's a question I get asked all the time, because this is sometimes for some folks, it might be a long process to get all of this in place and to get the Medicare, but I think it's worth it. Why is it worth it? Benefits of having Medicare. If I have Medi-Cal already, why the heck do I need Medicare? You get access to more doctors, more providers, more hospitals, more facilities take Medicare than they do Medi-Cal only, simply because Medicare pays more. Doctors' offices and hospitals get paid a higher rate with Medicare than they do with your CalOptima Medi-Cal only. Medicare enrollment options are increased. So if you do have Medicare Part A and B, then you could actually enroll into a Medicare Advantage plan if that's what you want. Medicare Advantage plans, a lot of them come with like bonus additional benefits. Some of these Medicare Advantage plans include what we call DSNPs or MMPs. They include care coordination, you get assigned like a care coordinator who can help you navigate all the specialists that you're seeing, because some of my clients are seeing like 6, 7, 10, 12 doctors all at one time. And so you could get someone from the Medicare plan to help you coordinate all of that. And Medicare Advantage plan oftentimes will offer what we call supplemental benefits that Part B only doesn't. So things like dental, vision, over-the-counter stipends, gym membership, and oftentimes they'll include like emergency worldwide coverage. So there are plenty of reasons to want to have Medicare, even if you already have the Medi-Cal, because it allows you to see more doctors and it allows you to get potentially access to more benefits. Okay, how do I spot someone who may need QMB? So this is kind of this is what I'm looking out for when I get a caller. Green card holders who have lived in the US for at least 5 years. Those who have SSI and who are older than, or 65 and older, they might have Medicare Part A, but not, Medicare Part B, but not A. If you're eligible for SSI financially, you should be eligible for QMB. But the great news is the change that occurred in the law is that starting January 1 of this year, these folks are now auto-enrolled. So folks don't have to do that two-step process. They now are auto-enrolled. Okay, for those who don't have enough work credits, and that could be for different reasons, right? You could have been a homemaker. You could have been, the primary caregiver of family members, or, your kids, and you didn't work outside the house. Some of our clients, they've worked all their life, but they've worked for cash. They worked quote, under the table. So they necessarily didn't pay into the Medicare pot or system. So that's plenty of our clients who have worked really, really hard, but unfortunately they didn't pay and pay the Medicare taxes to be eligible for Medicare. And then certain public employees prior to 1986, if you worked at like a school, like a public school district, the city or the county or the state before 1986, those folks were not required to pay into Medicare. And so sometimes those folks don't have enough work credits. So these are just some of the things that, might apply to you, where you might want to think, maybe I am eligible for QMB. Or little to no work in the US. I've had clients where they'll say, my mom and dad, they've worked hard in their home country for many years, and I'm bringing them here, to retire. And so they don't have any work credits in the US to be eligible for Medicare. So I've had some of those, adult parent calls. So if any of that sounds familiar to you, give us a call and we can screen you for QMB. All right, here's the summary. I know I threw a lot of info at y'all. Some of these slides are like just the cheat sheets that you're going to want to refer to later on. But again, if you need any sort of assistance, feel free to give us a call. But this is the summary. Again, starting July 4th, when HR 1 passed, this is now the limited immigrant categories who are eligible for free Part A. Again, it's only the US citizens, it's only the green card holders, only for the Cuban and Haitian entrants, and only for the COFA residents, Marshall Islands, Micronesia, and Palau. For premium Part A, so when you have to pay for the Medicare Part A because you don't have enough Medicare work credits, it's only limited to citizens and green card holders who have been in the US for 5 continuous years. Other takeaways, premium Part A, if you have to pay for your premium, but if you have QMB, the state pays for these premiums, so you can save this $500. Okay, QMB pays the $500 per month for you. Medicare with QMB may be automatic enrollment for some folks, some of those SSI folks. For Medicare and QMB enrollment may be 1 or maybe 2 steps for some folks. We talked about that. And then you may be eligible for Medicare and not know it. So if you think you are, or if you're just curious to know, give us a call and we could screen you and see. Medicare means access to more doctors, hospitals, facilities, and other additional supplemental benefits that Medicare plans might include. Okay, I think that's it. Okay, this is a summary. This is how you can reach us. I think we're phasing out our 1-800 number, so we're now referring our clients to our 714 number. You press 3 to get to the health unit, and we're open from Monday through Friday, 9 to 5. And you could also fill out an online intake during off hours at our website. Our services are free. We're a nonprofit. We don't charge for our services. Other know your rights, I'm gonna skip that. Okay, and this is a presentation survey. If you wanna let me know how I did, good, bad, hey Joan, you need to fix this, or hey Joan, that was a little boring, or hey Joan, this is too much, or hey Joan, great job.